Assalamu alaikum, everyone. Good morning, good afternoon, or and good evening, depending on where you're joining from. And we are yet here again with the next NCDs from the clinical research landscape, challenges and opportunities from the APPNA Medical Education Research, International Training and Transfer of Technology Subcommittee. As people who are participating in the audience are aware that we do this every 2 weeks, so it's a bi-weekly endeavor from us, and we invite leading institutes from all over the country to present the research activities. My name is Sarfraz Hasni. I am a I'm a rheumatologist and director of the clinical research at the National Institutes of Health in Bethesda, Maryland. And I have the honor of moderating these sessions so far. And my personal interest is in premature cardiovascular diseases and have studied this topic. So I'm really excited about the two speakers that we have today. And both of them belong to the National Institutes of Cardiovascular Diseases in Karachi, Pakistan, which is one of the premier institute in public sector taking care of cardiovascular diseases and has multiple branches across the province of Sindh. The first speaker we have is Dr. SOHAIL KHAN, who is the Chief Operating Officer of NICVD in Karachi, in Pakistan. He's a graduate of ASGHAR Khan University. And after his graduation, he was trained in several top institutes in the United States. And he's an experienced cardiologist who's a member of the Diplomat American Board. And he is well versed with a variety of cardiovascular and structural and peripheral vascular diseases. In addition to that, he also has a healthcare management hat, and he has a healthcare management degree from Harvard University, and he's passionate about healthcare economics and providing quality healthcare to his patients. And he has now joined the NICVD in last few years, and has before that he has successful leadership positions in various places in the United States. And he's the chairman of the New Cardiovascular Horizons, which is a multidisciplinary cardiovascular conference in Salt Lake City, Utah. And he's also a faculty speaker and on multiple national and international cardiovascular conferences. Our second speaker is also from NICVD, and he's the director of research, Mir Asghar Ali Khan, who is responsible for research, development, promotion, and compliance. And he has over 20 years of experience in various disciplines for research and grant management, including women and child health, cardiology, and multiple other fields. He has a master's in research administration from University of Central Florida and an MBA from Pakistan. And his vision is to serve the underprivileged population in the developing world by advocating and promoting transparent, effective, and impactful research. And before the webinar started, we were having some informal discussions, and just by discussions, I can tell you that both Mir Asghar Ali Khan and Dr. SOHAIL KHAN are very compassionate about what they are doing, how to improve the healthcare outcomes in reference to cardiovascular diseases. Before I hand it over to our speakers, there are two quick announcements. So one is that whoever attends these meetings, we provide them a certificate of attendance, which you will get shortly afterwards. These webinars are all video recorded, and they are on the our YouTube channel. So, and they're very fast. They're available within a few days, actually, and even sooner sometimes. The other announcement is that we are also going to start a capacity building series where we're going to be embarking upon how we can do capacity building in terms of research, clinical research in Pakistan. And please stay tuned for those webinars coming up very soon. And lastly, but not least, is we're always thankful for the technical support from Waleed and his team, from the APPNA MERIT technical team. And of course, the stalwart and who's our captain is Dr. Syed Uzair, who's always arranging and finding people and interesting topics. So Dr. Syed Uzair and Dr. Sarwat Hussain are here, and they will be the discussion or the panelists. And what we request you to put your questions in Q&A and introduce yourself in chat, and we will get to them. Hopefully the presentation is about 45 minutes, and then we will have time. Dr. Zair and Dr. Sarwat will man the Q&A and chat, and then we'll just take those questions accordingly. So with that, I will stop here and hand it over to Dr. Sohail Khan. And after that, it will be Dr. Mir Asghar Ali Khan. So please, Sohail, take it away.
Thank you so much for your kind introduction. And let's see. Can you guys see my slides?
Good. Perfect.
All right, guys. So this is Sohail. I'm the Chief Operating Officer, NICVD Karachi. I'm also consultant interventional cardiologist here. Joined here in 2021 and joined as a cardiologist from the US. I've spent about 18 years of my life there and wanted to serve in a public setup. And honestly, before I came back to Pakistan, I really heard about NICVD. But since then, I've been mesmerized and surprised by the impact this institute is having on pretty much everyone in Pakistan. I would not say just in Karachi or Sindh, but throughout the country. So if you look at the reach of NICVD, we have about 10 hospitals with the active cath lab where we perform primary angioplasties. And besides that, we have about 26 chest pain units. And I'll come to chest pain units, what exactly they are, but these are small setups where we provide the initial cardiac care, before we send them for any primary angioplasty. And with that, we have tried to provide world-class cardiac care at the doorstep. For example, in the past, if someone had a heart attack in Sukkar and they had to drive 8 hours to Karachi, I mean, most likely they will die, as you know, in heart attack. Time is muscle. So now we are providing those services in those areas. So it has really made a huge impact in terms of cardiovascular disease. So if you look at NICVD, we started back in 1960s when the population of Karachi was mere 1.6 million people. But last 50 years, the population has increased to more than 15 to 20 million, 2 to 3 crore. So this one center was not good. And as you all know, being a South Asian puts you at the highest. If you look at the American College of Cardiology guideline, just being a South Asian puts you at the high risk for CAD, and that's something I've seen in the last 2 years. Just the huge burden of CV disease. I've seen cardiac diseases in people who are their early 20s, early 30s, even in their 40s. Their heart, the coronaries looks worse than the folks in the US who are 80 years old. So this is how we started back in 1960, just one center. Now we are about 36 units that include 10 hospitals, 26 chest pain units. And this all changed back in 2014 and 15 when there was an 18 amendments and the provincial government had more say in terms of they started getting their more budget. And one of the priorities with the Sindh government was health, and that's where they invested the most. So for example, back in 2015, we used to treat maybe 500,000 or less. Now we are treating on average 2.3 to 2.5 million patients every year. Nowadays it's a time of AI. The data is gold, and that's what we have here. I mean, we have a huge number of patients that we treat. And most importantly, all the treatment we provide are free of cost. I mean, you cannot even imagine this in countries like the United States, where if you are, you do not have insurance, and if you do out of pocket, that can put you into bankruptcy. I mean, in a country like Pakistan, third world country, we are performing these angioplasties and TAVRs and PTMCs all free of cost. So if you look at the stats, I mean, this is the number that I just showed you, like before, 2014, less than 500,000. Now we treat, more than 2.2 million patients every year. And just look at the sheer number of primary angioplasties. Again, back in my program in the US, I mean, we used to primary PCI maybe 100, 200 a year. Here on average, we treat about 20,000 primary angioplasties, about 4,000 open heart surgeries every year. We do PTMCs, we do TAVIs. Look at this number of, emergency visits, OPDs, and even we do ICD, CRTs, permanent pacemaker implantations. Just the Karachi center, I'm not talking about those 10 satellite hospitals in SOHAIL, Larkana, Tanduk Muhammad Khan. Just the Karachi centers, we do about 9 to 10,000 primary angioplasties every year. And then we have, just looking at the number, it's not only about the number of surgeries we perform. Now it's about 4,000 surgeries, but since 2014-15, we have also decreased the mortality, surgical mortality, from 23% to less than 4%. And now we have we are in a true sense, a tertiary care cardiac hospital. We have a critical care team on board. We have a critical care, cardiac critical care fellowship. We have fellows who train in this subspecialty. We have nephrologists. We have ventilators, and we perform minimally invasive surgeries as well. So we, again, I did not know about NICVD. Once I joined in, it was really a revelation for me that these high-risk procedure, very advanced procedure, can be performed in a public setup, and that's what is happening. For example, TAVRs. I mean, we are performing TAVRs on regular basis. And then PTMCs, we see a lot of rheumatic fever, rheumatic heart disease, mitral stenosis. And unfortunately, it is a disease of a poor man and woman. A lot of time they go to private setup. It costs 4 to 5 lakh rupees. And we regularly perform these PTMCs, not only in NICVD Karachi, but also in Tanduk Muhammad Khan as well as SOHAIL. And most importantly, the stroke intervention. We are the only in a population of 20 million plus people. We are the only center who performs endovascular stroke interventions. And we all know, I mean, stroke is not something, either they die or they are bedbound for the rest of the life. And this is not only a life-saving procedure. For example, if a poor man has a stroke or heart attack, and if they get complication or they die, it puts, again, the whole family into poverty cycle. And this is what we do here. Even many private institutes or all private institutes in Karachi does not perform stroke interventions. We do. And again, it's all free of cost. Every stroke intervention costs 8 to 10 lakh rupees. We do it free of cost. And now we are going to start the stroke program. Not only we are already doing in Karachi, we're going to start this program in SOHAIL and Tanduk Muhammad Khan as well. The other program we do is pediatric cardiology. I mean, it started from only 4 beds. Now we treat hundreds of patients. We not only have general cardiac peds, we do surgeries, we do pediatric intervention. We have the only fellowship trained in pediatric electrophysiologists who's serving at NICVD. So we have that too. And this is the volume you see. I mean, if you look at the pediatric intervention all the way down, it has gone from 300 to almost 1,500 pediatric intervention that includes PDA closure, ASD closures, the pulmonary stenosis interventions. And if you look at the pediatric cardiac surgeries, congenital heart, I mean, we do about 1,500 every year now, and the number is only increasing every year. So this is another building right next to our main building. It will be a dedicated pediatric cardiology hospital. It is under construction, and it should be operational at the end of this year, early next year. It will have cath lab, it will have CT scan and MRI. So again, we are starting to develop our program further. We have fully upgraded cardiac imaging department with CT scan. We just acquired 1.5 Tesla cardiac MR as well. And then, as I said, we have electrophysiology program where we do the AFib ablations, cryoablation, 3D mapping, ICD, CRT. Again, let me, say it's, again, all free of cost. And, I strongly believe that the legacy of any institution, it is in the research, the paper you write, but it is in the people, in the doctors that you train who are going to serve the people, serve the next generation, who can go to every small city all over the Pakistan and serve the community. And that's what we do at NICVD. We have a fellowship program, not only in adult cardiology, but also pediatric cardiology, intervention, cardiac surgery, critical care, cardiac imaging. Right now, at this moment, as we are speaking, we have about 120 to 130 general cardiology fellows. We have about 40 interventional cardiology fellows training right now. So another, the key factor, the success factor is that, we are seeing the immigration of talented people from Pakistan. There's a brain drain. And I would say NICVD, I would say, is the only place, the only institute in Pakistan which has seen reverse migration in the last 2 years. So I joined in 2021, and after me, other folks like a very good friend of mine, he was my classmate, Dr. Abdul Hakim. Professor Abdul Hakim is now Director Cath Lab. He used to serve at Rutgers University in New Jersey, highly accomplished, highly published. Then we also got Professor Dr. Sabah Bhatti. She is the head of our cardiac imaging and very well versed with cardiac CT, cardiac MR, over 10 years of experience in the US. We have Dr. Hana Asghar. She used to work as an interventional cardiologist, but then she decided to be part of our preventive cardiology. As I tell folks, my fellow, that the last 1 decade NICVD was a pioneer in interventions in Pakistan, but the next decade NICVD should be the pioneer in preventive cardiology, because prevention is better than cure, is cheaper than cure. And the amount of disease that we see here in Pakistan, I think we need to do something differently. We just cannot keep putting stents in people. I'm not very proud to be doing 20,000 primary angioplasties every year. Again, this is coming from an interventional cardiologist who does that for a living. So about the clinical research, I'm going to let Asghar talk about it more. Again, there's a huge data, and the one thing that we were not very strong at, to be honest, was research, but we are trying to change that in the last 1 year. Since I joined in, we tried to bring a well-known, well-accomplished director of research like Mir Asghar. And we are already working on bringing some organization changes. And I think if you have a good system in place, those changes are, last longing. So again, going back to our impact everywhere, these are our satellite centers pretty much throughout province of Sindh. And then these are our 26 chest pain units. I mean, basically, it all started in 2017 when this mammography container came from Germany, and no one knew what to do with it. And what we did was we converted this into a chest pain unit. As you all know, in any busy city like Mumbai, Karachi, or Pausalo, for example, if you have a heart attack in Nagin Chorangi, for you to get to NICVD, it might take you 2 hours. So why not put this container there? So this container is fully equipped with on-call doctors 24/7. It has ECG, it has ventilators. You can intubate the patient. If the patient is having MI, you can give them heparin, aspirin, and transfer to primary PCI. And as you know, 90% of the chest pain are non-MI patient. But then now we are trying to leverage our presence at 17 location under the busy intersection, under the busy bridges within Karachi. We can leverage that to start preventive cardiology clinics over there. So you can just imagine the amount of volume or the amount of people that we can reach. So these are our 26 chest pain unit. I mean, pretty much we have covered the whole Karachi of 20 million people here. But then we also have these chest pain unit. I just inaugurated 2 more chest pain units in Kashmir as well as Tata in last 2 weeks. So again, these are the number of patients that we treat in our chest pain units. Again, we are in the Sindh, but we pretty much serve the whole nation. For example, if you look at this slide, I mean, we are getting patients pretty much from all over Pakistan, from Azad Kashmir, from Gilgit-Baltistan, from Khyber Pakhtunkhwa, from Punjab. And most of the patients are coming from Balochistan region because the Sindh is right next to Balochistan. And we never ask when the patients comes to us, we never ask where you're from, or where you're coming from, what is your socioeconomic status. We just take care of them. It's all free of cost. If you go to our emergency room, we don't even have the cash counter. So the future plan is, again, our building, the main NICVD Karachi building was built back in the 1960s. It has the capacity of only 200, 250 patients. So now we have about 600 beds. We see about 1,000 patients in the ER every day. We see about 1,000 patients in the OPDs every day. So now we just did the groundbreaking ceremony about 2 months ago. We will be constructing this brand new the cardiac hospital, 1,200 bedded hospital in Landi, Karachi. It will be state of the art with its own comprehensive research facility as well as nursing school. Again, it will help us to offload our current capacity and build our capacity, and also to serve more and more people. So this is pretty much it, the short of who we are at NICVD, and I'm going to let ASGHAR talk about the research work that we do here, and what are the areas of collaboration that we can work with APPNA and our other colleagues around the world. Thank you.
Thank you so much, Dr. Sohail. That was very insightful. Let me share my screen.
Can we let Dr. Abdul Hakim join in as a panelist, please? Thank you. Please, Dr. Abdul Hakim.
He has joined already.
Yes,
Dr.
I'm here.
Sohail, he has joined. Yeah, he's
Okay, good.
on
Thank
the
you.
stream.
Thank you and welcome, everyone. Are you able to see my screen? That's my first question.
Yes.
Okay, great. Well, Dr. Sohail explained a lot about the wonderful work that NICVD is doing. And my presentation is basically going to create a bridge between what are the strengths of NICVD and how can our friends and colleagues at APPNA and other parts of the world can optimize or utilize this opportunity by creating a grant mechanism whereby NICVD is fully prepared to take care of grants. And I will also touch a little bit in the next 15-20 minutes that I have about the research, clinical research landscape in Pakistan, and what are the challenges and the opportunities that do exist over here. So, in a nutshell, Pakistan has immense potential of undertaking clinical trials. And when I see it has immense potentials, I can corroborate all this through 4 points. The number one is we have a very high disease burden in Pakistan. Most of us are already aware of it. The number two is we have a treatment naive population, which actually supports an enrollment of clinical trials. The number three is relaxed regulatory requirements that we have in Pakistan. When I say relaxed, I don't really mean they're extremely flexible. Yes, they have their own stringent processes and procedures that we have to comply with. But in terms of the timelines, and as Dr. Rizal also mentioned at the start of the program, our regulatory authorities are really struggling hard to provide a better and conducive environment for institutions and universities to conduct trials in Pakistan. And a lot of interest, you can see a lot of growth in the interest of people to conduct clinical trials in Pakistan. So how is NICVD capitalizing on the opportunities that we have for clinical research landscape? And how is NICVD addressing the challenge that we have? That's what I'm going to be presenting in the next few slides. So NICVD is primarily all geared up to undertake clinical trials, and be it a hospital-based study or a community-based study with revamped research management services that we have over here at NICVD. Dr. Sohail touched base on the innovations and the new things that we have been able to undertake at NICVD to prepare and present NICVD as a research conducive institution whereby a lot of collaborations can happen between NICVD faculty members and the faculty members who are outside of NICVD, be there in Pakistan or outside Pakistan. So just to give you a snapshot, we're working on about $1 million funding, 9 trials that we are currently in process of negotiating and signing off, and 14 to 15 proposals are underway with international and national funders. So you might ask me, why should NICVD, why should you or why should any other institution that's in North America or any other part of the world should collaborate with NICVD? So I have noted down 6 major reasons why you should collaborate with NICVD. The first one is Dr. Sohail also mentioned in his presentation that we serve one of the largest cohorts of cardiovascular patients in Pakistan. In fact, it would not be a very tall claim if I say that NICVD serves the largest cohort of cardiovascular patients across the country. And therefore, for any clinical trial or a collaborative study, you as the funder or you as a collaborative partner will get an opportunity to be enrolling patients at a very fast pace. The second is very obvious. We have a very lean, mean strategy to work on our grant financials. The cost of enrolling a single subject for clinical trial and another research study is very low. That actually gives you and that actually gives us a kind of strategic advantage when it comes to negotiating clinical trials. One of the major concerns of institutions and individuals comes whenever they're trying to think of collaborating with any government institution in Pakistan is whether the funds will be channeled and managed transparently. I can assure you, and Dr. Sohail and Dr. Hakim on the call would endorse, that now we have a very transparent mechanism of financial administration of all kinds of research funds that we have received and we are continuing to receive for different grants and programs that we are managing. We have a team of highly experienced and qualified researchers in different specialties and subspecialties in cardiology and cardiac surgery. We are very much compliant with all the regulatory requirements for whether those requirements are national or whether those requirements are international. I bring along with me 20 years of experience of when I was working with ASGHAR Khan University, whereby we had numerous funders, and then we have to collaborate and ensure that we are compliant with whatever regulations and policies that they have. So I bring along all that experience to NICVD and therefore position ourselves as an institution that can work on research collaborative grants in a very compliant manner. And we have expert grants management services, which include pre-award, post-award grants management. I'm going to touch base a little bit more on this in the slides to come. So there's a country attractiveness index by Dr. Sarma Ratnam. All of you might be aware of it. So all these factors actually corroborate with those country index to make Pakistan as a country and NICVD as an institution very research intensive and research attractive. Okay, so this has been explained very well by Dr. Sohail. So we have 10 state-of-the-art cardiac hospitals and 26 chest pain units. Why am I putting this slide? So if you're collaborating with NICVD for a research trial or a grant, you not only have the opportunity to be working in Karachi, but we have extended arms in rural and peri-urban population of Pakistan. For instance, if you're a trial in which you wish to enroll rural population, so NICVD has greater presence not only in Karachi, but also in rural and peri-urban areas of Pakistan and Sindh. We cover almost all parts of Pakistan. Everyone is most welcome, be it ER, be it consulting clinics or BD. So we welcome and treat all kinds of patients coming from all parts of the country. It's a requirement in Pakistan that if you have to conduct clinical trial, your site should be duly certified with the Drug Regulatory Authority of Pakistan. And I'm very pleased to share that NICVD is duly certified by DRAP as an approved clinical trial site. So what themes do we work on? Okay, so first one is preventive cardiology. Second one is non-invasive cardiac imaging. We do interventional cardiology a lot. We are into cardiac surgery, and we are into cardiac electrophysiology. And last but not the least, we are also into cardio-obstetrics. So if you have any project or any research idea in mind that you wish to collaborate with, and you're looking for an institution that has a very large base, very, very great opportunity for recruiting patients, optimal cost, great transparent financial management systems, and you can pick and choose from all of the 6 research teams that we have, I would urge you to think about in terms of collaborating with NICVD, as we have greater opportunities and we have shown that we have successfully conducted trials at NICVD. We have recently shifted our data management to RedCap. Most of our research projects that are being conducted at NICVD, the data management component of those projects are being entered and managed through RedCap. Our researchers are enrolled and also taking initiative to undertake different compliance certifications, which are being offered by CITA program. We offer all our researchers free facility to enroll in CITI and get certifications, be it human subject regulations, be it good clinical practices. And as part of IRB, it is now a requirement for an ICVD that if a researcher has to submit a research proposal, he or she has to submit his or her good clinical practice certificate along with the IRB application. We have a very transparent, as I mentioned earlier, mechanism of financial administration. We have a system in place whereby research grants can be tracked easily and transparently, and financial reports can be generated for the funders so that they can know, they get to know how their money is being spent. We constantly strive to improve. Therefore, we have a continuing capacity development program at NICVD, especially when it comes to NICVD research. We recently completed a series of 4 capacity development programs, and we are now continuing to start up more programs whereby it's not only the research capacity of our investigator, but it's also the research capacity of our research staff that's actually working and nurses that we have at NICVD, so that we have a holistic approach in improving the overall strength and capacity at NICVD when it comes to research. The IRB has recently been revamped. A more responsive and robust IRB has been initiated, whereby investigators do not have to wait for months or weeks to get their IRB application approved or reviewed by IRB. We have expedited system, we have exemption systems and all that. And just to give you an idea, our cardiac surgery is using Dendrite, which is you might be aware of it, state-of-the-art UK-based registry system for cardiac surgery. And we have also been involved in NCDR, which is a cardiac interventional cardiology registry, whereby our data is manned and faculty is able to extract information and data from these registry and write research projects and write research publications. There are very few names, because if I were given space to write all the names of our researchers and people who have acclaimed publications, then this slide space would be small for me. But just to name a few, we have Dr. Abdul Hakim, we have Dr. Rajesh Kumar, Dr. Javed Sehal, Dr. SOHAIL Khan, and our executive director, Dr. Nadeem Khamar. And we have good number of publications in accredited journals. And the idea is not just to have a publication in the journal. The idea is to create a knowledge that can be scalable and applicable to institutions that are worried about low-cost interventions. So we work on ideas and research concepts whereby we generate knowledge for managing cardiac and cardiology patients in low-cost environments. As I mentioned, this is my basically specialty. We have a very robust and active grants management system in place now for pre-award, whereby our team develops the proposal and develops the budgets for different funders and collaborators. We have expertise in contract negotiations, be those contracts as CTAs or be it NDAs, be it material transfer agreements, data transfer agreements, and all those contracting. We have a very good financial support from NICVD, and we do a very good post-award management. And not only that, when the grant comes to a closure, we have a very adept system of closing the grant and formally accounting for all the inventory and all the things that we are answerable for with the funder. Thank you so much for your attention, and we are open for questions now.
Thank you so much, both Dr. SOHAIL Khan and Mir Azhar Ali Khan. Azhar, can I ask you to please stop sharing? Thank you so much. So I see that we have a huge number of participants, despite this is being the APPNA weekend where convention is going on. And I see that the both the chat and the Q&A box is lighting up. Dr. Zair, I think before we take the question, there are two people in the audience that we would like to add. One is Dr. Abdul Hakim, and I think there was somebody else that was requesting to
Is
be.
Dr. Saeed Ashraf. He's a cardiac surgeon from UK, and if you can also add him.
Dr. Saeed is already here, and then if you can add Dr. Abdul Hakim also, and I'll hand it over to you, Dr. Saeed Uzair, for your comments. And I see Dr. Umar Haya, Dr. Sarwat Hussain, Dr. Saeed Ashraf, and hopefully Dr. Abdul Hakim can also join in a minute. Again, thank you so much. It was a very excellent overview and very impressive. Please, Uzair.
Thank you, Sarfraz. And once again, thank you, Dr. SOHAIL Khan, Mir ASGHAR Khan, Professor Saeed Ashraf, Professor Sarwat Hussain, Dr. Umar Hayat, all of you. And I'm surprised to see one thing, how much interest is being generated. And I remember Dr. SOHAIL was not very sure that so many people will be participating in the audience because there is the activity going on. And this is one of the best participation so far we have witnessed. It means the interest is huge. People would like to know, people would like to associate. You are being the prime institute in Pakistan. And, my submission is that in the future, please do have a series of such type of webinar just to tell the people across, people are participating from Khyber Pakhtunkhwa, Punjab, West Coast, UK, everywhere. So I'm not going to take any time because this is a very precious time. We have the very experienced people. So first of all, I will just ask Mr.
Doctor, can
yes.
I go first because I have to leave for APPNA meeting?
Sure. Please introduce yourself briefly, Professor Sarwat, and then, continue. Yeah.
Thank you very much. It's Umar here. Really impressive. I mean, in terms of the analytical technology, the instruments you guys have, and you're absolutely right. I think we hit the highest number of the participants in this webinar. So I have a very few questions. In your sponsors, how many are from the industry?
Khan, over to you, the question.
Mir ASGHAR, do you want to join? Do you want to answer that question?
Yes. Okay. So we have about 3 trials that are industry sponsored, and the rest are foundation sponsored.
I see. So I think the one thing we need to do, I mean, given the different research institutes are doing like in a solo, so I think we need to create a platform where all different CROs and hospitals can work together and properly, I will say, showcase the capabilities we have in Pakistan. That's number one. Number two, my next question would be, how many of them are investigational trials? I mean, I know, because I think it's always good to have these sponsors like UNICEF and UNO to do kind of the observational studies, and which we are doing wonderful because of our population and number of patients we have. But I think we really need to move to the next step, which is trials. That's where the research is, and that's where even the revenues are. So my question is, how many of them are investigational trials?
Dr. Umar, I'm very proud to state and answer a question that all of them are investigational trials. All of them are experimental studies.
Nice. Wonderful. Thank you. So, Dr. back to you. Will not take much of the time. Thank you.
Oh, thank you. Thank you very much. So, Professor Sarwat, just a couple of words from your side.
Ji, assalamu alaikum, everyone. I think there are two things I would like to say, and then I'll have a question. And one is that all this is because of Dr. Syed Uzair. It is amazing how he has, honestly, it is just amazing that at national level, he has contributed immensely. The second is that in this day of doom and gloom, it really is a shining light. This presentation was such that I was wishing that it would not end, because this is one good news after another. And every time we listen to such excellent presentation, the hope for the future of Pakistan, kind of becomes alive. And I know that there are, and we know that there are so many centers of excellence in Pakistan, and inshallah one day there will be some coordinating body effort, or whoever, government, whatever, that can propel the whole of the country forward in all walks of life. My question is that I am interested in global radiology, and I'm writing a book on radiology in for low and middle income countries. So my interest is that, are we at this is not a criticism, please. Are we at NICVD reproducing the models of Western teaching hospital model, teaching a research model, or are we doing it within the resources of a developing country, so that other developing country and benefit to humanity at large can be passed on to the other countries that are low income or middle income countries? So I think one of the great advantage for NICVD, like brilliant team and resources, is that they produce a model that can be emulated by people and places of less resources. And I'm going to stop here.
So just to answer one part of your question, whether NICVD is doing something that can be an example to other countries, low to middle income countries, and I would say yes, from a clinical standpoint. For example, if you take our chest pain unit model, all right, and you don't need to build a brick and mortar kind of building or put a lot of money into it. I mean, this is just containers that we have parked under the bridges, and this can be applied to heavily populated like cities like Mumbai or Sao Paulo or like Lahore as well. I mean, the thing that I'm doing, it was just for chest pain. If you're having chest pain, you come in and we diagnose you and you ship you. But then just imagine if we can also digitize it. If we can, I'm also in the process of putting telemedicine, units in it, right? And we can start seeing patients for routine hypertension and preventive cardiology, right? Again, this is very, very impactful at a low cost. And yes, I don't think this kind of model exists anywhere in the world, but I think we can definitely teach this lesson. So I did a 2 minutes video on this chest pain unit a couple of months ago, and I can assure you, I started getting emails from India and Africa. They wanted to know more about it. So that's something we should be very proud of. Okay, and then the one other.
Has this been written up for the in journals so that others can follow?
I am in the process of doing that right now. I think we need to document it properly. And the other thing is, yes, we hear about doom and gloom, and things can be very challenging. And again, I've lived 20 years in the US and came back 2021, and it's not being a smooth ride, but then you got to have a thick skin, and you have to have a certain passion and certain mission that comes from within. It's not something that can tell you or teach you to survive here. But then we have the other issue is that there's a lot of flight of talent, not only doctors, but accountants and software engineers and IT people. But there are people like in the audience, we have Dr. Saeed Ashraf. He's a practicing cardiac surgeon in the UK, but he has taken it upon himself. He visits every few months. He spends a month with us. He trains our surgeons. He gives us some protocols, and that is something that our American colleagues can do as well. And I'm sure for a lot of APPNA doctors or American doctors, at some point you all have thought about moving back to Pakistan, but we couldn't do it because of family and kids and whatnot. But there's always that that fire. You want to help the country, and this is one way that Dr. Saeed Ashraf is doing, and the other way that you guys can also do that, not only in terms of coming here and spending a couple of weeks, but at the same time, you should try to bring some research, collaborative research. Of course, we are always short of funds. I mean, providing free of cost treatment is not a joke. I mean, we live grant to grant. but that's somewhere that you guys can help. You guys can come in, and not only in research, you want to be helpful with the patient care as well. So again, it was a long answer, but I don't know, Asghar, you have anything else to add in terms of research? The only thing we can teach others is leveraging our data. We are sitting on a gold mine if we can use it right. And
Maybe
that's
I
why
can.
we need you guys.
Okay. Thank you so much, Sohail, and definitely shows that you're very passionate about this. And we will definitely try to build some bridges and help in whatever way we can. I think let's give some time to Dr. Saeed Ashraf. He's here and we can hear from him. And also, Waleed, is it possible to bring Dr. Abdul Hakim in the panels also, so we can hear from him also?
I think it's raining in Karachi, so he's having some electrical issues at his house. So he left, I guess.
Over
Okay,
to Professor Saeed Ashraf. Yes, please.
Yeah, thank you very much. Assalamu alaikum to everyone. I thought it's only UK where it rains, but nice to know in Karachi it's also raining. Okay, right. To be honest, it is very, very good program, and we have to do it more often. I have been living in the UK for last 36, 37 years. And I don't have much family connection in Karachi, but when Nadeem approached me to do all those things to train and give them protocol, so I've been coming to NICVD for the last 1 year. Every 3 months during my annual and professional leave I take, and I go to Karachi, stay in hotel. And on Sunday, I run a wet lab. I take a valve from here or some conduit, some instrument from my unit, and I get bovine heart. And then I teach on whole Sunday for 4 hours. And then same operation I teach on patient on Monday till Saturday. So it is hectic, but at the same time, it is very, very rewarding. Trust me, trust me. And I recommend all my colleagues in the Europe or in the USA to do this. It does work. You just need a passion and vision and determination. That's it. Now, NICVD is blessed with a number of patients and specimen we have got there. To be honest, we can translate into research, both quantitative and qualitative. And there we are lacking. And it is case in everywhere in our country. I've been told when I started my residency program here by my professor, Magdi Yaqub, you must have all heard, unless you publish, you will get perish. If you do any operation, any intervention, only patient and relative will appraise you. But you want to make a name and you want to pass it on to humanity, you need to publish. Publish, publish, publish. For that part, to be honest, I just secured a very good NIH grant of worth of 2.8 million. And I was planning and I had a meeting with ASGHAR Sahab, and each time I miss Sohail. I don't know why, when the time will come when I'll sit together in the office. And hopefully that will start what is my dream is to bring that qualitative and quantitative research, which I have got the grant. It will be all with cardiac surgery related. Okay. But before that, one is the most important prerequisite for that is the data. Unless we have revalidated data, correct revalidated data system, we will not be able to convince the world that our research is correct. And for that part, I managed to secure, and I was really, I'm grateful to Nadeem Qamar, really grateful that he bought it, dendrite system. When I visited in September, first time, I gave 33 recommendations, 33, how to improve surgical department of NICVD. And out of those 33, the most difficult part or recommendation was to buy a dendrite database system, which we use, logistic Euroscore, in all over the world they are using now. And that is very, very expensive. And when I was writing, I was thinking, oh, it won't happen, it won't happen. And within 3 weeks, Nadeem rang me, sir, we bought it. I was over the moon. I was over the moon. So we got the data system, we just need to put it and revalidate it. And money will flow. Trust me, I just sent 10 animal pigs work to Belgium to get my LVAD research of platelet activation, because I couldn't do it over here because I had only 4 animals. They were all on site or admitted. I couldn't admit more. So I sent 10. If we have good animal lab at NICVD, trust me, that will be your revenue generating machine. It will be all South Asian people from cardiovascular will ask you to do. I sent last year my 4 LVAD to Austin to check the homeostatic biocompatibility because I couldn't do more than 3. So that's the thing. So Nadeem has promised me that in Landhi unit, basic science and animal science research, I will be conducting and building a block. I have submitted the business case to the Sindh government of 88 pages. Basic science and animal lab, I'm sure Sohail must have read it and ASGHAR has read it. So there we need to help NICVD, both intellectually, financially, and bit of advice. And that's what I recommend that all my North American colleagues, if they can do the same, we can really work together for the betterment of our poor nation, which for them, we all owe a lot.
Thank you so much, Dr. Sayed, for your very good comments, and looks like you're making a true contribution. I see Dr. Umar has his hand raised. I'm sure he may have something to add.
So I really, when Dr. Sohail mentioned the data, this is a trier, and we should really take the advantage. And we are collaborating with the company, silicon-based artificial intelligence-based company. So I think I will send somebody to connect with you, and then we can utilize that data. And of course, the hospital will benefit because there will be a huge payment coming back to you guys. So that's the last comment I want to make.
So I see
you can get my email from Sarfaraz, and they're most welcome. I said you can get my email from Sarfaraz, and please like stay in touch. Whoever wants to meet us, we would love to show them around here.
Sure. So just if you can send me your email, I'll certainly share it with Omar. And I see there are a lot of questions though, and maybe if we can answer some of them either in the chat, because I think we want to make sure that the participants feel that their questions have been heard. I see that there's tons of them. And then I think Dr. Sarwat also have to say something. He's raising his hand. So Sohail, and if you can take some of the questions, and then we can go to Dr. Sarwat.
Just a comment, actually, just that I'm available to help in any way possible. I'm just a student of radiology. So let me know, please.
Thank you, Dr. Sarwat. I have been answering some of the questions that have been appearing in the chat box by typing the answer. And one important question that has come is, will NICVD spread its capacity to Balochistan, as in your stats, Balochistan patients were most needed, probably he wanted to write. Will NICVD, is NICVD thinking of a branch or a unit at Quetta?
So actually, I had a meeting with the health secretary Balochistan about 2 weeks ago, and of course, they want an NICVD satellite center here, but the problem is who's going to pay for it? You know, it's a Sindh government, and how can the Sindh government pay for facility in Balochistan? So I think it should come from Balochistan government, and the thing that I proposed when I was sitting with him, that we can sign an MOU between NICVD and government of Balochistan, where we can help you in capacity building. You can send your staff, your doctor, your nurses to NICVD. We will train them, or our surgeons can come to civil hospital in Quetta, Balochistan, and train your surgeon, train your staff. But when it comes to building a physical structure there and then running it, right, it involves a lot of money and time and human capacity. So I told him it may be difficult, but other than that, we are there to help them. But they should come from the government of Balochistan themselves, and they have asked us for help, and we have been helping them.
So I think a lot of questions in the Q&A and in the chat is about, I think they're either the medical students or early career investigators who are asking how they can join research at NICVD. So either Asghar, you or Sohail have any like a point of contact or something concrete that we can tell our participants?
So the one thing that I would say, I get a lot of requests from medical students in their third year, fourth year. They want to do some electives here. I think the best way to get involved is that they should come for electives, spend a month or 2 months with us, do some clinical work, and at the same time, they can get involved with the research. I don't think there is a dedicated research electives at NICVD, as I know, but that's something we can explore in the future. For example, once we build this program, we can start dedicated research fellowship, a year or 2 year fellowship in the future. But as we stand now, there's no dedicated research elective, but we do like, clinical research. So these students are welcome to come and join us, do some clinical work, and we can definitely involve them in some ongoing research work.
Okay, and I think Dr. Saeed Ashraf has to say something, but one question I think which intrigued, can I just wait one and then? So one question that was in the participants and a lot of people have asked is this question, which maybe Sohail, you or Dr. Saeed Ashraf can answer, is that we see a lot of early or a much high incidence of cardiovascular diseases in South Asian population, and people are getting cardiovascular diseases at a much younger age. So I know it's a complicated answer, and there's genetic, epigenetics, and so many things, but do you have any insights, Dr. Sohail? And then after that, we'll hand it over to Dr. Saeed. It seems that he has to add something more.
So again, it was shocking. I mean, shocking will be the understatement of the word. When I came to Pakistan, I mean, in 6 hours, 8 hours caught, I would get 12, 15 heart attacks. In 24 hours, we get 35, 40 heart attacks. So this is I think this is a true healthcare emergency. It is a true sense of pandemic in Pakistan. Why? There are multiple reasons. I mean, like specifically in Karachi, again, South Asian genetics, diet, tons of carbohydrate-rich diet, lack of exercise, lack of activity, and our city planning is such that we don't even have a proper walking footpaths. People, they started building construction or small buildings or plazas in every corner of the street. And then smoking, increasing incidence of diabetes, and then just overall lifestyle in Karachi. People stay awake till 2 o'clock in the morning, and this is whole disruption of that normal circadian rhythm and a lot of stress. Again, the one common thing I see among a lot of patients when I see those 50 heart attacks they do the next day, you round on them. Of course, they have some have diabetes, some have family history, but the one common denominator in every patient that I see is poverty. When we look at the social determinants of health, poverty, that can lead to lack of access to medication and transport issues and whatnot. So that I see a lot. Just multiple factors, a perfect storm here.
Dr. Saeed, you were saying something. Sorry.
Yeah, that was very good question. One of the question was asked in your chat list about how to involve research. To be honest, I firmly believe research doesn't start once you're a qualified doctor. It should start from the time of the medical life, medical student life. And like in the UK, and I'm sure in America and Germany, we all have mandatory final year, 3 months elective. And the medical student, they go for 3 months. and I get 2 each time, each session, and we give them a project like atrial fibrillation, to myocardial MI, or primary PCI, and they do audit and they present and they put in their folder. So we got to start this from the medical school level. If they can, if it is embedded in their syllabus, that 2 to 3 months, depending upon each medical colleges, what their syllabus is like, then we can really make it, and you will reap the reward in next 5 to 10 years. That is a way forward where we do it in West to start the research mentality from the medical student life all over.
Absolutely. Thank you so much. I think we are out of time now. We're try to keep it within 1 hour. And again, I would like to thank the team from NICVD, both Dr. Sohail Khan and Mir Asghar Ali Khan. And of course, thanks to our discussant, Dr. Saeed Ashraf, Dr. Uzair, Dr. Sarwat Hussain, Dr. Umar Hayat, and of course, the participants. And that is the source of our driving force for us. So thank you for everyone for joining. I know it's a little bit late in Pakistan right now, but we'll come back with another in the series in 2 weeks. And Dr. Uzair, if you have any parting words or comments before we end.
I think just a couple of words. First, about the animal lab, there is a very good lab with the Dow University of Health Sciences. So they presented, I can get connected Professor Saeed Ashraf to them. And their director is also in the participant right now. And the next thing is about the Professor Sarwat Hussain. He is the founder of radiology department in ASGHAR Khan University Hospital. So he is a totally dedicated to provide support to public sector institution, and he's also involved in healthcare delivery quality systems. So the audits and all those things. So he was very kind and humble, not sharing about his core strength area. He will be very happy, Dr. Sohail, to extend all his support to both the project, NICVD, as well as the Quetta project. So he's very kind, very dedicated, committed person. So these are the 2 brief comments. Now, Sarfraz, you can say thank you, and we stand closed.
Thank you. And just in the interest of capacity building, I was looking at the chat. Dr. Sarmad Rehan from the University of Agriculture in Faisalabad has also put in the comment that they have conducted research on coronary vasculature in rabbit fetuses. So they are happy to collaborate and connect. So maybe offline, Dr. Sarmad Rehan can connect with Sohail or Mir Asghar and see if there is a way they can collaborate. Because one of the major things that we would like to do is to connect people and bring them to a same platform. So again, in the interest of capacity building. So we are way over our time. And I again would like to thank everyone for joining and for the technical support from Waleed and his team. And with that, I'll say goodbye, Khuda Hafiz, good night, good evening, wherever you are joining from. And we'll see you back in about 2 weeks.
Thank you, everyone.
Good to see all of you.
And Sohail, I got your email, so we'll stay in touch with you.
Sounds good. Thank you. It was a pleasure.
Thank you. Bye-bye.